Thank you so much. Thank you so much, Jennifer. I'm grateful to be presenting to you, and I hope that everyone can hear me. I think you probably can. Thank you so much. I love April. It's a month that we learn so much and we meet so many. I know that Jenny and I are incredibly grateful to our parent leaders who are on the panel joining us today, as well as the Office of Child Abuse Prevention, Caltrin, Strategies 2.0 for their incredible leadership and partnership in our shared work to create a family and child well-being system. This is a system that seeks to act before harm happens. In today's session, Jenny and I will be rethinking the child welfare system, moving from mandated reporting to community supporting. In the session, we will ask whether children are better served by reimagining the role that many of us hold as mandated reporters and shifting that role to be more of a community supporting model. We will also share how throughout the state, we are examining the role, as Hillary said, that role of mandated reporting in child welfare and highlighting new recommendations and practices throughout the state from really transforming and becoming that community supporting system. I am joined not just by Jenny, but Crystal from Office of Child Abuse Prevention, who's going to help us in changing the slides. So Crystal, thank you so much in moving to the next slide. In this presentation, we will be discussing this recently issued brief. We put a link into the chat, Creating a Child and Family Wellbeing System, a paradigm shift from mandated reporting to community supporting. And we hope you look at that website as well as have an opportunity to download that report and take a closer look at it. But we'll be sharing throughout. If you could go to the next slide, Crystal. Many have helped us to create this issue brief, and we are incredibly grateful for CDSS and the Office of Child Abuse Prevention for asking, for really commissioning Safe and Sound to write this publication. We also want to thank, in addition to those listed on the slide, we want to thank IE Communication for their support in helping us to write this as well. If you could go to the next slide. Safe and Sound is really an actor in this. We have a front row seat into the reform efforts of this work. We're an insider and have an understanding of where and how practices, policies, and laws can be reformed to really support children and families. As you can see from this slide, Safe and Sound has 50 years of experience in supporting children and parents, caregivers, and families. This is our 50th year. And through that time, we have led and co-led the San Francisco Child Abuse Prevention Council. That was our founding entity. We currently continue that work as well as co-lead the San Francisco Child Advocacy Center, the San Francisco Family Resource Centers Alliance, the network of family resource centers in San Francisco. We co-chair with the Child Parent Institute in Marin County for the CAPC there. We're a member and a proud member of the Greater Bay Area Child Abuse Prevention Council Coalition. I know many of our Greater Bay Area colleagues are on this call today, and thank you so much for your leadership. We are also the co-chair of the California Family Resource Alliance's Policy Committee, with Sheila, a member of the Citizens Review Panel, and a member of the Prevention and Early Intervention Committee of the Child Welfare Council, as well as CDSS's pre-petition representation work group. Mostly, we are mandated reporters and train with mandated reporters, suspected child abuse and neglect. And so in that, we want to acknowledge that we are complicit in participating in a system that is inequitable and often does harm to children that it is intended to protect. We wrote this report to acknowledge that complicity, as well as move forward for reform. If you can go to the next slide. Why is this important? I'm going to spend just a little bit of time about explaining why this is important from our perspective, and then I'll move over to Jenny, who will share recommendations and policy and legal, as well as practice reform recommendations that we want to put forth. This is important, and I think our parent panelists will share their perspectives and really underscore why this is important. And I'm so grateful again for them to be on this panel. I also wanted to share the voice of Shelley Lopez, who guided our work, Safe and Sound's work, in drafting the issue brief. Shelley is a parent leader with whom we have worked. She works in the Greater Bay Area, the Northern Greater Bay Area. She's a parent, and she's also a mandated reporter. And she shared with me that her daughter was born medically fragile. She had no support from her family. I didn't know where to go for help, Shelley says. I didn't know how to ask for help because I didn't know what I needed. The domestic violence in her home got worse because of the stress of being a parent of a child with significant needs. When the police called CPS, I had no idea that my child could be removed because I was a victim of domestic violence. How could they take her away? I believe that my experience in my daughter's life would have been different if we had had support, if someone had explained the failure to protect laws. Even though my daughter was in foster care for less than a year, she continues to suffer from this experience. Shelley, thank you so much for sharing your words and your perspective. If you could go to the next slide, Crystal. And I also wanted to share the sentiment of other mandated reporters throughout the state. And this echoes what Hillary shared earlier, that many of us are acting on fear because of the system that's been created. This is a quotation from Kimberly Giardina, who is the director of child welfare in San Diego. And she says, the child welfare system has historically been rooted in fear of rare, tragic cases of severe abuse that are missed, and of the consequences to the child and the professionals involved. We must resolve the dilemma of keeping children safe and supported without magnifying the feeling of threat, fear, and surveillance often associated with mandated reporting. Thank you, Kimberly. And if you could go to the next slide. In addition to, and you can click through all the way to all the bullets. In addition to these perspectives, I wanted to share the quantitative data to show why this is so important. And as this slide shows, there is significant disproportionality at all stages in our current child welfare system that none of us want. For example, data shows that almost 25% of white children in California were investigated by CPS by age 18. This compares to roughly 50% of Black and Native American children. And I wanted to underscore that this data is current, and it's from the Child Welfare Indicators Project in California. And if you could go to the next slide. And you can click through all the bullets. Furthermore, only 13% of reports to Child Protective Services are substantiated. Again, this is the most currently available data. 432,000 children were subjected to a CPS report between April of 2021 and March of 2022, and 56,000 children were found to be maltreated. Actually, that substantiated report. Again, Black, Native American, and Latinx families are significantly more likely to have a report of substantiation and have their children separated from them and placed in foster care. If you could go to the next slide. This is a quote from a colleague of ours in San Francisco, Jessica Matu-Newsom, who's a program director of the Family and Child Services. And she says, when we discuss the data that I just shared with you, people are shocked. Black and Native American children and families are touched by child welfare systems at disproportionately higher rates than any other group. Understanding this disproportionality helps us examine our own biases and start to think about how we can be part of the change instead of part of the problem. Thank you, Jessica. We're grateful to you for your partnership and your work. If you can go to the next slide. So you can see there are many perspectives, data to support this work, and the momentum continues to grow, as Hillary said, to think differently and support parents like Shelley. As you know, there are, and we'll talk about it, there are several efforts in California to create a child welfare system that is focused more upstream in an effort to create a pathway to well-being at a community level, to really reimagine how to keep children and families safely together. This is essentially the Families First Prevention Services Act mandate and captured in California's proposed 5-year prevention plan, which is under review, as well as being developed in counties across the state in our comprehensive prevention planning efforts. Integral to California's plan, and I really thank the leadership in California, is the development of a robust community pathway for families to access culturally responsive, equitable, and relevant services. Services that Jennifer spoke about, services that families know from providers whom they trust and call for a prior call, prior to the hotline being called. The success of this community pathway for achieving well-being can only be realized if current practices and policies change. Jenny's going to talk about this. These policies with respect to mandated reporting and the response to child abuse and neglect allegations that dramatically need to reform. This is evidenced by these large volumes of reports going into child protection hotlines each year that are screened out, unsubstantiated, and include allegations of really only neglect. It's around neglect that we have such an incredible opportunity to make change. As you may know, depending on the jurisdiction, 2/3 to 3/4 of all cases of child abuse and neglect are neglect cases. And so there's a real opportunity on these cases to think differently. This is certainly one of the reasons why we wrote the brief. You can see this momentum continuing to grow. If you go to the next slide. In March of last year, and they just reissued the report again with some additional updates, the Legislative Analyst Office in California provided an analysis of mandated reporting, looking at important data and asking incredibly important questions about the impact of racial disproportionality in the child welfare system. And in September of last year, just in the fall, the California Citizens Review Panel, of which Sheila is a representative, I'm on it as well, submitted recommendations to CDSS to reimagine mandated reporting system to a system of mandated supporting. Safe and Sound issued our issue brief in September, also in the fall of that year. And then just a few weeks ago, the Child Welfare Councils adopted the recommendation of the Prevention and Early Intervention Committee. And I see the clap going up the screen. Yes, it was a big team effort to approve the recommendations of the Prevention and Early Intervention Committee to move that work forward and to build a task force to think about, and an advisory could think about, how do we develop in California provisions to change the laws, change the policy, change the practice, develop trainings, and to really deeply look at a community pathway. In addition, there's many, and I know there's so many on the call from these different jurisdictions that are putting forward incredible reforms to lever and address the racial disproportionality in Humboldt, Inglewood School District, Los Angeles, Sacramento, San Diego, San Francisco, as well as Ventura. So to continue that drumbeat, I'm going to connect it over to Jenny, who will share recommendations in terms of the policy and practice changes. Thank you so much.
Next. Hello, everybody. I too am very honored to be here and to be able to bring forth some of the incredible work that's being done throughout the state and the country to create a new framework for child safety that is really rooted in community success rather than, as Hillary said, reporting. As Katie laid out, the quantitative and qualitative data make clear that to continue to move towards a creation of a system of well-being, we dramatically need to reform our current system of mandated reporting, including the practices, the policies, and the legal constructs. I'm going to walk through some of the recommendations with the caveat that these are really initial ideas that we have gathered from experts in the field, practitioners, those with lived expertise, and we know that a lot more needs to be done to come up with a really comprehensive, actionable, and workable plan. And we look forward to that work that Katie mentioned that is being done at the state level through the creation of a task force to look at this. The first thing, as you'll see on this slide, before anything is really going to happen, we need to change our mindset. And we particularly need to change the mindset of all of us who are practitioners and who are mandated reporters. We came into this work, and I know many of you on this call, we came into this work because we wanted to be supportive. We wanted to figure out how we could support children and their families. But in order to do that, we need to change to ask that first question of not should we report, as Hillary said, but how do we keep families together? What can we do? And here's a list of, potential questions that we may talk about in changing with respect to when mandated reporter trainings are happening. Let's look at what are the strengths in of the families? What are their needs? What resources might we be able to connect them to that would really support this family so they can provide their children with what every single parent wants to provide their children, with the love and safety and the ability to be successful. And those who are working on the system, we need to ask, how do we change from what is now really a fear-based system of if you don't report, you're going to be liable for something, into that system of support, which really honors why most of those who are mandated reporters came into doing this type of work. And we need to think about how do we develop that true community pathway, both so that the practitioners, the mandated reporters know how to refer families and how so that families can actually access it. Let's move to the next slide. And can we move to the next one, Hillary, or Crystal, and we'll go back to this one. I want to start with also this framework of looking at what are the legal and legislative reforms we might think about. As Katie mentioned, this really involves the definition of neglect, how that fits within the mandated reporting laws. And we focus on neglect because neglect is the majority of the reports. Neglect is often conflated with poverty, and only 13% of all reports are substantiated. We want to create a legal system that really places families at the center. Some ideas, one that happened last year in the last legislative session with AB 2085 is how to change the definition of neglect. And that bill changed the definition of neglect to exclude a parent's economic disadvantage. So now mandated reporters, when they're looking at, do I report something on the basis of neglect, need to think about, or is this something that I'm concerned about that really relates to the family's economic status? And if so, ask that question. Can I connect this family with supports rather than report them to child welfare? AB 2085 also raises the standard of when to report to one of substantial risk of suffering serious harm or illness. And again, that's raising the level of when you look at this family, is there really that substantial risk of harm, and asking that question. Once all of this is done, or once we start to look at this change definition, we're going to need to look at what are the guidance the guidance across the state in order to implement these changes? How do we educate the mandated reporters on this? Will there be a requirement that there's a specific uniform training that all mandated reporters might receive? We also want to look at this question of liability for mandated reporters that I talked about before, which really creates that underlying system of fear, and look at, can we change that system of fear and reduce this area of liability for mandated reporters for failing to report? We also might want to look at the numerous categories of mandated reporters. In the law, the categories have just continued to grow, and we're up to about 50 categories now. Particularly, there's a catch-all provision in Section 8, and we might want to look at changing that so that fewer people are brought into this fear-based system of required mandated reporters. And finally, I want to just say that we also need to better understand the data. So we want to look at laws and policies around disaggregating the data, so we really understand what that category of neglect is and how that category of neglect disproportionately falls on Black and Native American families. Crystal, if you can go back to the prior slide. In order to build this true community system of support, we need to ensure that we invest in a pathway of support, in a community pathway, and that we invest in those resources that families will need. Because if we just change the laws and have fewer families reported to child welfare, that doesn't really serve that new stage of creating that system of well-being for families. We want to look at the fact that the systemic racism throughout our country has deprived many families of color, many Black, Indigenous, and Latinx families of accessing those basic needs that they need to thrive. So we want to look at investing in basic supports in our state and throughout the country. There's been incredible recent research out of Chapin Hall showing that basic supports really reduce the child welfare involvement. There was one study that showed that $1, just $1 increase in minimum wage resulted in nearly a 10% reduction in neglect reports. We also want to think about, how do we create a system that has navigation for families, that allows families access? So we want to think about, how can we link together the multiple systems that families have to navigate? How can we make them culturally appropriate? How can we provide for the linguistic support so families are able to access a variety of different services? Next slide. I also want to talk about, what are some of, not only just those legal changes at the state statutory level, but what are some of those potential policy and practice forms we can look at? One is something around group decision-making. This is something that is happening in a variety of different counties. San Francisco has some practices going on at our public hospital, where when there is a concern about a family and a mandated reporter is thinking about making a report, that mandated reporter within their organization has the option of working with others in cross-sector within their organization to really ask about the safety risk of that family and the strengths, so that they can look at that family and determine whether it really is that risk of safety to the child, or whether there is something else that the organization can do to build the support for the family. There's also some things such as technology solutions that we might want to look into. Some people may have heard of something called Unite Us, and those solutions will allow better connections and closed loop referrals so that mandated reporters can further that system to develop that community pathway that we talked about before. Next slide. And then I want to focus a little bit on the sort of brass tacks of the mandated reporting, and how are mandated reporters going to learn about looking at this in a different way, and when there are changes in the law. So one way to augment mandate reporting that I know is being done in Humboldt County is to really provide mandated reporters with the tools to access those services that they know will support the family. So if they are looking at, let's find an alternative to reporting to child welfare, mandated reporters need to know what that alternative is. So can we combine with mandated reporter training or some other resources around mandated reporter, the resource lists, the access to how do we refer families, the contacts, so that we can directly refer families to those services and supports. We also want to make sure mandated reporters are aware of how bias, their own implicit bias, may impact their reports. And so we might want to look at including implicit bias training with mandated reporter training, or information on that, as well as including in that training statistics around disproportionality and the disproportional impact of child welfare involvement on Black, Indigenous, and Latinx families. Next slide, please. These are just some comments. As Katie mentioned, Safe and Sound provides mandated reporter training in San Francisco. And these are some comments really kind of supporting what I just talked about from mandated reporters that we've trained. This first one is about, we really do need to know about the resources to be able to refer families, because if we don't have that, we don't know where to go. And so sometimes a report to child welfare happens because we don't know where else to go. We also, and again, we provide statistics regarding proportionality in our trainings. And we've found that people really appreciate that and did not know about the disproportional impact of referral to child welfare before seeing that in our trainings. Next slide, please. And finally, underlying all of these recommendations is the need to engage those with lived expertise, the need to engage tribes, the need to engage stakeholders across the community, a variety of community members, so that we can really be informed on how to do things differently. We don't want to just continue to repeat what we've done in the past. But as Hillary and Katie said, this is a real opportunity, and we want to make sure that we take that opportunity and are informed by those who have experienced the system and those who know what they need to thrive. People know what they need in order to support their children in the way that they want to support them. Thank you. And I will turn it back to Jennifer.
Great. Thank you so much, Jen.